test on that, but just so you know. So we have these two sinuses. One's a frontal. So if you ever get a sinusitis or a sinus infection, it's often because mucus is collecting in this frontal sinus, which makes sense. Here's the frontal bone, and then here's the sphenoid sinus. And so we have this network of air canals to help kind of equalize pressure. When we take a deep breath, it's going to go through what's called the external nares. It's a fancy name for the nostrils. It's going to move into what's called the nasal cavity. So this is all nasal cavity. And you see these flaps, these are the concha. Kind of like means shell, right? And they look kind of like shells. And so you have the superior, middle, inferior nasal concha. Their job is to swirl the air around. Because if it's hot, you want that dry, hot air to be cooled and moistened as it swirls before it hits the lungs. Or if it's cold, we want the air to be warmed and moistened. So it's really important to have this big nasal cavity. So once we swirl the air around, we're going to continue on down to areas called the nasopharynx. Okay? The word pharynx, kind of think of airway, because there's different pharynxes or pharyngeal areas as we move down towards the lungs. There's the nasopharynx up here, and as we turn the corner past the soft palate, because we have soft palate and hard palate, and see how this is bony? That's the roof of the mouth. That's the hard part of the mouth, roof of the mouth. So hard palate and soft palate back here, which you often don't deal with as much in healthcare unless someone has hiccups, and you have to depress that soft palate to stop the hiccuping, or have them drink some water upside down. That also works. Okay, so we're in the nasopharynx, and we get past the soft palate. Now we're behind the tongue. This is the tongue. So think of oral or mouth. Oral pharynx, yeah? And then continuing on past the epiglottis, we have what's called the laryngopharynx, named for the larynx. So let's just shift over this for a minute for this part, because you'll see it's basically the same model, but the epiglottis, I like the epiglottis here because it shows it being a structure with cartilage supporting it. And so when we're breathing, you see how the oral pharynx goes in the laryngopharynx. There's the vocal folds, or vocal cords right here in the laryngopharynx. And so sometimes when people get laryngitis, these folds get inflamed and they can't talk. Okay, this epiglottis is going to drop when we're swallowing, because right behind the trachea is the esophagus for food. And so when we're breathing, open. When we're swallowing, closed. So here's a nice example here. Let's say this is the epiglottis. So right now you're breathing, but you want food to go down the esophagus. So the epiglottis is going to close, seal the trachea, and now we can swallow. So breathing, swallowing. Now the problem is when people talk and eat at the same time, the epiglottis isn't sure what to do. And so we sometimes get obstruction at the opening into the laryngopharynx. Okay, the laryngopharynx is really well protected because there's a shift over here. Thyroid cartilage, which tends to be bigger in males, sometimes called the Adam's apple. Right? So there's the thyroid cartilage, and then it transitions into what's called cricoid cartilage, which are rings, which we can see here. This is a cricoid cartilage, and here's the thyroid cartilage. See how huge that is to protect that important airway. There's a thyroid gland right there. And we have one of the tonsils there. I think we've covered this model pretty well. Yeah. Okay, moving on to the lungs. The lungs, so this should look familiar. The thyroid cartilage, cricoid cartilage. So the neat thing about the lungs is we have 5 different lobes. And so if someone takes a gunshot to the left side, well, we still have 4 functioning lobes, which makes a big difference. On the left side, you might notice there's only a superior and inferior lobe. The right side, you have superior, middle, and inferior. Okay, so remember, it's your patient's right side. Think of right with 3, because 3 has the letter R, and there's 3 on the side. Left, 2 lobes. And as long as we're here, let's pretend like we pull away the alveolar tissue, alveoli, and we're looking at what's called a bronchial tree. Notice I have the thyroid cartilage facing anteriorly, so I know this is right. So here's the trachea, right? The trachea is the same thing I talked about here. Below the vocal folds, trachea. And the trachea is going to branch into a right and left main bronchus. You've probably heard of bronchitis, right? It tends to be an upper airway inflammation, inflammatory disorder. Then these are going to branch, so the bronchus is going to branch into what's called lobar branches. And then the lobar is going to branch again into what are called segmentals. And the segmental tips, this is the bronchiole that is going to empty into the lung. And if you remember on your slide, microscope slide, you had alveoli and bronchioles. So on the slide, you're seeing the terminal branches out of the segmental branches. Yeah. Got it. Questions?